Good afternoon, and thank you for joining us for today's CMS 1500 Q&A session. I'm Sarah McDonald from the Stakeholder Engagement Unit at the Workers' Compensation Board. To assist you with your questions today, we have several board staff from our Medical Director's Office and our Data Management and Analysis Office. This one-hour session will start with a brief overview of the CMS 1500 initiative and review most of the frequently asked questions. We will then turn the bulk of the session to answering any additional questions you may have. As of August 1st, the board will no longer act on or enforce payment of any paper CMS 1500 bills, and payers can deny them. So converting to electronic submission is critical for providers to continue getting paid for services and treating injured workers. We urge all providers to not wait any longer, and today's webinar is designed to answer questions you may have to help you understand and comply with the mandate. We ask you to please keep your phone lines muted, as we'll be using the chat feature to receive your questions at the end of today's presentation. You may enter your questions throughout the presentation in the chat box located on the right side of your screen. We'll answer as many questions as we can, but if you have questions that we don't get to today or think of something after the session ends, we'll be providing you with resources at the end of the presentation. A recording of this webinar will also be available on our website and YouTube page in the coming days. But before we dive into today's presentation, we would like to get some specific feedback while we have you. If you are not already submitting CMS 1500 bills to an electronic submission partner, what is holding you back? Let us know in the chat. Today's presentation will largely focus on your questions about the mandate for providers to submit the CMS 1500 electronically through a board-approved submission partner. We'll start with a brief overview and then review the top questions we have received. We will then spend the rest of the time answering any questions you may have. The board provided notification of the new requirement in August and November 2024, and again in January and March of this year. We want to emphasize that this requirement is mandated regardless of office size or patient population. There are many benefits to providers, which we will go over shortly. But please note, starting August 1st, the board will no longer act on or enforce payment of paper CMS 1500 forms, and workers' compensation payers can deny them. Forms that are submitted prior to August 1st, 2025 will continue to be processed, but providers are encouraged to transition to electronic submission before August 1st. Now we'll take a minute to highlight the many benefits of electronic submission. First is faster bill payments. Providers typically get paid quicker. Next, we have reduced administrative burden. The electronic submission partner submits the CMS 1500 to the insurer and the board. Some electronic submission partners will accept paper CMS 1500 forms and convert them electronically. Providers will have confirmation within 7 days that their bill was received by the insurer. With date timestamp acknowledgement of receipt from the insurer, the provider is aware that they do not need to resubmit the bill. Technical errors are identified quickly, so they may be corrected and resubmitted instead of waiting for the insurer to deny the bill. And finally, no or low cost. There is a designated CPT code that reimburses providers for up to $1 per transaction. To make the electronic submission process as easy as possible, the board will soon be removing the requirement for providers to log into the medical portal and accept the agreement for electronic submission of CMS 1500 before working with a submission partner. This step will be removed as of July 28, 2025. So you do not have to wait. With this change coming, providers who have not started the electronic submission process can simply contact a board-approved electronic submission partner. You can see the list that we have on our website, and arrange for electronic submission of the CMS 1500 form beginning July 28th, and no later than August 1st, when the mandate takes effect. Any electronic submission before July 28th will still require the providers who have completed the medical portal agreement setup. Please note, this applies to each provider in a practice who treats workers' compensation patients. Let's review the electronic submission process. You submit the bill and the narrative attachment to the electronic submission partner by an agreed format, and they will electronically forward both to the workers' compensation insurer. Providers who wish to continue using paper bills will still have the ability to submit a paper CMS 1500 form to certain, but not all, electronic submission partners, who will then convert it and submit it electronically to the payer and the board on the provider's behalf. Providers who wish to submit a paper CMS 1500 form must ensure the submission partner they choose has this capability. There are submission partners who take paper and those who do not. The insurer will then accept the CMS 1500 form from the electronic submission partner and return electronic acknowledgement of receipt. The electronic submission partner will forward the acknowledgement, including the date it was received, to you. The electronic submission partner will also transmit billing data, CMS 1500 forms, and the narrative attachments and the insurer's acknowledgement of the receipt to the board. Now we'll review some of the most frequently asked questions. Our first question, is there no way to opt out of this? We are a very small practice and we do not have very many compensation cases. Our response is that all healthcare providers, regardless of office size or patient population, will be required to submit the CMS 1500 Universal Medical Billing Form electronically to a board-approved electronic submission partner effective August 1st. The benefits will include faster bill payment and no or low cost, as well as mentioned previously, providers can offset the cost of electronic submission. Our next question. If providers are not enrolled for electronic submission as of August 1st, what happens to their claim? And our answer is that if you submit a paper CMS 1500 bill on or after August 1st, 2025, the payer will not send you payment, but rather an explanation of benefits or an explanation of reimbursement that references CARC 16, RARC, and 34 codes, which indicates your bill was not submitted electronically. In order to be paid, you must resubmit the bill to the payer electronically through an approved electronic submission partner within the statutory time frame or within 120 days from the day the medical care was rendered. Our next question, where can we find the list of board-approved electronic submission partners? Our answer is the board posts a list of approved electronic submission partners on its website, including their contact information and pricing information. But we encourage you to check the list regularly. It is expected that this list may change over time. Visit the CMS 1500 overview page on the board's website at wcb.ny.gov/CMS-1500 and click Electronic Submission Partners in the Quick Link section on the right side of your screen. Our next question, will more submission partners be available? It is expected that the list may change over time, so we encourage you to check the list regularly. Our next question, my claims clearinghouse is not on the list of approved submission partners. Does this mean I have to use a different partner to submit workers' compensation claims? Not necessarily. If your clearinghouse does not wish to become a submission partner directly, they may work with one of the approved electronic submission partners. Clearinghouses are encouraged to become electronic submission partners. Clearinghouses interested in becoming an electronic submission partner will need to register first with the board. All submission partners must test the CMS 1500 electronic submission and be approved prior to implementation. Our next question, can a provider contract with more than one submission partner? And our answer is that yes, but it's not necessary. If your electronic submission partner does not have a direct path to send a bill to a particular payer, it may be forwarded to another board-approved submission partner that will send the bill to the payer. When the payer acknowledges the bill, the acknowledgement date will be sent to your electronic submission partner from the one submitting the bill to the payer. When your submission partner receives the acknowledgement date, a copy of the bill with the acknowledgement date will be forwarded to the board. Our next question, how do providers offset the cost of electronic submission partners? And our answer is that providers will have the ability to offset the cost using an electronic submission of using an electronic submission partner by using code 99080. This was previously a no-charge NC code in the fee schedule listed as special reports such as insurance forms, more than the information conveyed in the usual medical communications, or standard reporting form. which may be used as a buy report BR code up to a maximum value of $1. The code should be placed on the same CMS 1500 form for which the billable services payment and the electronic submission costs are being requested. The price listed by the provider for code 99080 should accurately reflect the actual cost incurred by the provider for the electronic submission of the individual bill, up to a maximum of $1. Please keep in mind that when using code 99080 to the CMS 1500 form, when adding code 99080 to the CMS 1500 form, providers should input the last date the patient received services, listed on the form rather than the date of billing. Note, a provider who currently submits a CMS 1500 electronically via an electronic submission partner can bill to offset the cost. Where on the CMS 1500 form do I put the code 99080 for electronic submission costs? The code should be placed in box 24D on the same CMS 1500 form for which the billable services payment and the electronic submission costs are being requested. The price listed by the provider for code 99080 should reflect the actual cost incurred by the provider for the electronic submission of the individual bill, up to a maximum of $1. Our next question is, do we need to submit a narrative report along with the CMS 1500 forms, or just a summary of them? And our answer is that providers must attach a narrative report with the examination findings to the template. The additional narrative should include the history of the injury, illness, any objective findings based on the clinical evaluation, plan of care, and your diagnosis assessment of the patient. In lieu of using the template, the provider's own medical narrative report is acceptable if it includes work status, causal relationship, and temporary impairment percentage. Examples of narrative reports are available on the CMS 1500 requirements website page. Our next question, do we need to know the payer ID to submit electronically? Insurers and employers who have been approved to self-insure for workers' compensation benefits in New York State are assigned a 7-character identification number, which can be found on the payer's electronic submission partner lookup webpage. Additionally, approved electronic submission partners or clearinghouses are knowledgeable about correct payer IDs needed to deliver electronic medical bills to the payer. Our last question, before we review your questions that you have entered into the chat, is that do providers also need to upload submissions to the board's website as we do now? When the CMS 1500 form and narrative are submitted to the board through an approved electronic submission partner, providers should not mail, fax, or email a duplicate paper form to the board. For additional resources and all the details related to CMS 1500, including a list of electronic submission partners, FAQs, and discontinued forms by visiting wcb.ny.gov/CMS-1500. We also have a dedicated mailbox to answer all questions on the CMS 1500 initiative. The email address is cms1500@wcb.ny.gov. And as a reminder, if you're not already following the board on social media, we encourage you to do so. We are on X, Facebook, Instagram, YouTube, and LinkedIn, so link up with us. You can also subscribe to get board updates using the same ones our external stakeholders do by hitting Get WCB notifications on the bottom of our website. We thank you for taking the time to learn about the CMS 1500 and all the benefits that submitting electronically offers. But before we take time to answer your questions, please take a moment to let us know in the chat if you are not already submitting the CMS 1500 electronically using a board-approved submission partner, what is holding you back? So please enter your response in the chat. And now we'll take the rest of the time to answer your questions. You may hear a brief silence as we take some time to review the questions that have come to the chat, but we will rejoin you again shortly.
This is Dr. Tachi. There's a question in the chat that asks whether the 8/1 deadline is the deadline for submission date of the bill or the date of service. The 8/1 deadline is for the submission date of your bills. So for dates of service, up to and including 7/31, if they haven't been billed by then any bills submitted on 8/1 or thereafter have to be submitted electronically, irrespective of the date of service.
There's a few questions asking about how to accept the XML, the CMS-1500 submission agreement, as well as how to register for the portal to actually accept that agreement. The board actually issued an announcement Monday afternoon and issued another reminder today that as of July 28th, that agreement is no longer necessary. Any provider with that valid MPI can just submit the bills starting July 28th, so next week. You no longer need to log into the portal and do that. If you are submitting this week and you have not, you would have to, but as long as you start submitting next Monday, you no longer have to accept that agreement. If you miss that board announcement, if you go to the board website, scroll all the way down to the bottom and click View Board Announcements. It's right up at the top of the list of board announcements, so you can print that out for your reference. And for those asking how to register for the medical portal, just in case you still have to submit PARs or maybe an HP1 billing dispute, when you visit the board website, click Medical Portal under Popular Services. Under the provider option, there's an option called New User Access and Administration. When you click on that, we'll give you a quick overview of the medical portal, what providers qualify to register for the medical portal, and you can click that register sign up link right there and complete the registration. Right now, the turnaround times are about 1 to 2 business days for a medical portal account.
Hi, this is Audrey Cunningham from the Medical Director's Office. There's a few questions regarding the 120 days for submission of bills, and I believe that came from our guidance with respect to denying paper bills. So I'll start there. So if payers receive paper CMS 1500 bills after August 1st, the guidance has been to not, rather than submitting a C8.1B, payers are instructed to issue the provider within the explanation of benefits reference CARC 16 and WARC N34 codes, and this will indicate the provider's bill was not submitted electronically. For you providers, if your bill is denied because it's sent via paper after August 1st, providers must resubmit any denied bills to the payers electronically through an approved submission partner within 120 days that the medical care was rendered. So the 45 days for payers to pay a bill upon receipt, that has not changed. Payers are still required to pay a bill within 45 days or submit an objection within the 45 days of receipt. Hi, a few questions regarding the offset code. The question is whether or not 99080 is payable on a bill that has been denied by the payer, say, for example, due to a alleged lack of causal relationship. So the answer here would be no. The 99080 would not be reimbursed if the entire bill is denied. However, keep in mind that the offset charge must be reimbursed if the claim and bill are ultimately found to be compensable.
There's a few questions about submission partners and electronic billing. One of those is, what happens if your billing agent does not currently show up on the submission partner list? Many of those have relationships with those existing submission partners, so we encourage you to speak to your billing company, and they likely are probably submitting through those submission partners already. And there's another one, folks asking about what happens if you currently use paper There are some of the submission partners that will actually accept paper from you and convert those to an electronic bill on your behalf. If you go to the board's website and click on the CMS 1500 initiative, we'll drop a link in the chat for you shortly. If you go to that submission partner list, we do actually indicate which submission partners will drop a piece of paper into an electronic bill for you. And some of them have actually provided their costs up front, so they're right on the website for you.
There's a question as to whether the narrative report has to be the template that's available on the board website, or if providers can use their own narrative report templates. Providers do both. Some use the template that we provide, others use their own forms from their electronic medical records. The key components that have to be in the narrative are your standard subjective history, any objective findings on physical exam at the time of the visit, your assessment and your plan, and then the three critical components that you have to add to your narrative report for workers' comp that have to be displayed prominently are whether or not the patient is working, what the causal relationship is between the condition you're treating and their work, if you're a provider who's permitted to opine on causal relationship, and what their degree of impairment is related to the condition that you're treating. Again, if you're a provider who's permitted to give opinions on degree of impairment.
We had a question that what happens if carriers are not enrolled for electronic submission by August 1st? The carrier should have been enrolled by 10/1/21, and they will be penalized for not being compliant.
Hi, the question is, what if payers are not accepting my electronic bills? So for you payers out there, the payers have been mandated to accept electronic bills since October of 2021. So payers who are not compliant may be subject to penalties. So the payers should be in compliance. Please let us know if there are payers out there not accepting electronic bills and you want to be able to accept electronic bills or be subject to penalties.
We had another question here. Should claims be uploaded to both the workers' comp board and the payer? We are mandating that the clearinghouse should be sending both to the payer and the board.
There's a question regarding rejection from a submission partner pointing you to Department of Labor. Based on the link provided, that appears to be the federal government, which we would not fall under, so it'd be reaching out to them if it is a federal claim. If it's a New York workers' comp claim, then I would recommend reaching out to that clearinghouse submission partner you're working with, just to clear up the miscommunication there on what type of claim it is.
Hi, a couple of questions regarding some situational fields on the CMS 1500, such as Social Security number, Workers' Compensation Board number. Those are both situational fields on the CMS 1500, so this should not be the sole reason for denial.
There's a few questions in the chat about difficulty signing up on the portal and difficulty renewing providers' registrations with the board, et cetera. For questions like that, please feel free to reach out to us directly at mdo@wcb.ny.gov, and we can help you one-to-one. I put that email address in the chat as well.
A couple of questions with respect to reconsiderations. So the first issue is whether or not reconsiderations should be submitted electronically, and the answer is yes. And the second question is with respect to whether or not the offset charge also applies to bills submitted as reconsideration. And the 99080 does in fact apply to reconsideration. A payer does remain free to deny the reconsideration submission if the payer denied the original submission. However, if the payer agrees to pay on the reconsideration, it must also pay the $990.80 charge.
A few questions about payers, including a couple small payers that are telling providers that they are not accepting electronic bills. For any of those, we do ask that you email CMS-1500@wcb.ny.gov and just include the payer that informed you of that. That way we can look into that. As was mentioned earlier, payers who are not accepting electronic are going to be subject to penalties. There's a question asking if you still need to mail the bill to the insurance company and the board if you submit it electronically. No, you do not. The nice thing about electronic submission is when you submit through that clearinghouse, it goes electronically to that insurance carrier, and after it's accepted, a copy of that is electronically dropped to the board on your behalf, so that eliminates the need to have to submit paper to the board.
Hi, a couple of questions whether you are a dentist or another type of provider with respect to how you are going to get your supporting documentation, the medical narrative, any x-rays, supporting documentation to the board and the payer. So I'd suggest speaking with the electronic submission partner that you end up working with, what the proper format is, how they want you to send supporting documentation. There is a template for a narrative template that you can certainly use, but if you have additional things like imaging studies, talk to the submission partner. Perhaps they'll, they will work differently in terms of whether or not they would want that in a PDF or otherwise, but we encourage you to flesh that out with the submission partner. And then keep in mind that it's the submission partner who will then send that bill and supporting documentation both to the payer as well as the board.
A couple more questions about registration in the XML agreement. One of them is you have quite a few providers, and do they still need to enroll in the medical portal? The answer is it depends. If you need to become board authorized, if you're looking to submit prior authorization requests, or that provider is looking to submit HP1 billing disputes, yes, they would want to enroll in the medical portal. However, if that provider is just looking to bill electronically, no, the portal registration is not a requirement for the electronic billing as of July 28th. So in that case there, you're all set. Another question about clearinghouse that does not show up on the submission partner list, but you've spoken and they have a relationship with one of our approved submission partners. In that case there, you are all set to electronically bill. We understand that in the clearinghouse realm that, they submit through intermediaries. So as long as you have that, your billing agent has a relationship with one of the approved submission partners, they would just submit through them, and you would be all set.
Hi there. Just to follow up with respect to the agreement on the medical portal. So any electronic submission before July 28th will still require the provider to have completed the medical portal agreement step. But thereafter, that step will be eliminated. You won't need to sign. So, anything before July 28th, you will need to click on the portal and accept the agreement. And then after as of the 28th, that will be gone. Make it much easier for you guys.
There's a question regarding the fees that the electronic submission partners charge. I went ahead and put the link to our webpage into the chat for everyone. That'll take you right to the electronic submission partners page, and that lists their names, contact information, and the fees they charge.
I have a few more questions regarding the offset code 99080. So the provider, this is something that we put into effect to offset the cost of contracting with a submission partner. So the provider can submit by adding the CPT code 99080 to the CMS-1500 per bill. Keep in mind, if there are several dates of service on one bill, there is only one 99080 to be added. The second part of that is that, oh, I forgot my train of thought here. Looking at each claim, should we use this code? Yes. So the code will be used per bill. And if you have several dates of service on one bill, use the last date of service, the last date that the patient was seen for that 99080.
There's another question about the 99080 that says something along the lines of the patient treats with the practice twice per week. Can they use that code twice per week? The answer is the code is not related to the number of treatments. The code is related to the specific bill that you're submitting. So you use the 99080 code once when you submit an electronic bill. Many, if not the vast majority of practices, may put multiple dates of service on a single bill. So you might have 2 or 3 or more dates of service on a single bill. And then for that single bill, you would use code 99080 for the electronic submission costs of that individual bill. Also, as an FYI, while we're talking about the 99080 and dates of service, the date for the 99080 code should be the last date of service that appears on that particular bill.
There's a general question about the portal and not the CMS-1500 specifically, just asking if the portal has the availability to check claim status. The portal does not. There is a case search in there. If you're submitting a prior authorization request and you know the WCB case number or claim number and the patient's info, you can search in there, but it's not going to give you a true claim status. You still want to go through the insurance carrier for that information.
Hi, follow-up question regarding the offset code, whether or not supporting documentation is required for using the code, and it is not required for that specific code, no. Again, follow-up regarding the offset code. Keep in mind that the price entered for the code should reflect the actual cost the electronic submission partner is charging. So right now it's up to $1 that can be charged. So if you're being charged 25 cents, you should not be submitting for $1, submit for that 25 cents, just as an example.
We had a question in the chat regarding copies of the presentation. This copy, there will be a recording of this presentation uploaded onto the website within the next few days. We will also be sending out an email with a link to that recording as well.
Someone's just asking for the email address again where you can report a carrier that is not accepting EDI at this time. It is cms1500@wcb.ny.gov. Another question just asking if it's necessary to sign up with the board and the medical portal for electronic billing. The answer to that is as of July 28th, next week, no. If what you're looking to do is electronic billing, you do not have to come into the board and accept that agreement any longer. You do have to still find a submission partner to submit electronically through. So that step is still there. That is not within the portal. That's between you and the submission partners and clearinghouses. Again, though, if you are going to submit prior authorization requests, HP1s, or are looking to become board authorized because you're a New York State licensed provider, those do still require the medical portal to access. So you will have to sign up in those limited circumstances.
Hi, another question for clarification regarding the offset code and whether or not the 99080 can be used every single date the patient was seen. And to underscore Dr. Tachi's earlier response, the answer is no. The code is to offset the cost of submission of the bill itself. So if there are several, it's not to be used every single time the patient sees the provider. Again, it's per bill. You could have several dates of service on one bill, and again, include that last date of service with the offset code.
There's a question as to whether this only applies to the New York State Insurance Fund. The answer is no. The topic we've been discussing today applies to everyone participating in the New York State Workers' Compensation System. So all carriers and all providers will be doing electronic billing as of August 1st.
Question regarding how the copy of the bill gets to the Workers' Comp Board. For anything submitted electronically through one of the submission partners, again, you do not have to drop paper to the board. That submission partner will send to the payer. Once the bill is accepted, it will get electronically routed to the board, and we will receive a copy of that CMS-1500 and any attachments that were with that bill. So again, nice thing is, bill electronically, you do not have to send anything separately to the board.
Hi, clarification just in terms of getting the bill to the board and the carrier. Once you are all set with the electronic submission partner you choose to work with, it's the submission partner who will in turn send your bills to the board and the payer electronically. That is the requirement. The board and the payer will get the bills simultaneously.
There's a question, do we have to partner with an electronic submission partner, or will we be able to do this ourselves? And the answer is you have to submit the bills through an electronic submission partner.
Okay, well, thank you to our subject matter experts, and thank you to all of you for taking the time to join us today. In case you missed any responses, the Q&A will be included in the recording that will be available soon. Any questions that were not covered during the Q&A can be directed to cms1500@wcb.ny.gov. That is the email address you have on your screen, and someone will respond to your inquiry as soon as possible. Before we sign off, I would like to remind you to sign up to receive workers' compensation news, including information on future webinars, straight to your inbox. To sign up, visit wcb.ny.gov, scroll down to the bottom of the homepage, and select Get WCB Notifications. We also distribute information via our social media channels, so please follow the board on Facebook, X, Instagram, and YouTube. Thank you again for joining us, and enjoy the rest of your afternoon.